A quest to establish whether the spread of cholera in Mombasa County has been curbed led us to the Majengo Health Facility, where just last week over 10 patients had been admitted to treatment. Upon arrival, a worker at the facility revealed it had been closed by the county's health department following complaints allegedly from locals. In a bid to probe the issue further, we approached food vendors nearby who spilled the beans as to what may be hindering efforts to stop the spread of the bacterial disease.
Sisi kama wafanyabiashara ilikuwa tunaomba serikali iturumie. Kama wanaweza kubeba hiyo taka kila siku itakuwa tunashukuru sana. Manake kama pale kuna shimo nyingine hapo imejaza hiyo taka na mvua ikinyesha vile imenyesha kama hivi siku ya leo. Ni lazima tunakuwa na shida kubwa sana. Manake hiyo harufu hata inatushinda kukula hapa. Unaweza kushinda hapa kuanzia asubuhi mpaka jioni hujakula. Ni ufike ndani ya nyumba pengine uchemshe maji moto unywe ndipo upate kule chakula ule.
Customers wanaonaje na kuwa mnaoperate kando tu ya mahali ambapo pengine si pasafi?
Wengine wananunua, wengine wanapita wanasema majengo imezidi. Sasa tunashindwa tutafanyaje?
Kwa muda gani hizi taka zimekuwa hapa Majengo?
Kwa hivi sasa hii taka hata sijui mwisho ilizolewa lini.
30 minutes after highlighting the food vendors' health plight here in Majengo during our 1 o'clock bulletin, the Mombasa County government will bring in this bulldozer and 5 such trucks to clear the Majengo dumpsite. It will take an hour to clear the accumulated garbage, a relief to the residents who did not hesitate to criticize the move.
We have been having challenges internally in terms of the equipment we have. You see the turnaround time in terms of movement of garbage contribute to a builder. So if we delay to pick up garbage, you will see the situation. So we must admit, yes, the responsibility of garbage collection squarely lies with the county government. There is no somebody else. Previously, yes, there was somebody who was in charge, but the contract ended. Disbursement has been slow to come. You know, disbursements have been slow to come to the counties, and that explains part of the challenges that we have been having.
The state of affairs in Majengo mirrors several other dump sites that the small-scale business community have to cope with.
Yes, we have to admit that there is a lot of garbage across, but our commitment as a government is to assure the residents that all these mounds of garbage they are seeing will be cleared within the next 2 days. We have already started the process by yesterday. Part of the town already is clean. The island, as we are talking, has already been clean of the amount of garbages that are there. So we are now moving at the outskirts of the CBD. So we want to assure the residents, we're now approaching the Christmas festivity, and we want to assure the residents of Mombasa that they are going to see a remarkable improvement within a short while.
2 new cases of cholera have been recorded at the Mwembe Tayari Health Center days after the county government announced measures to curb the crisis. The 2 were admitted on Tuesday evening. The facility, located in Vita constituency, and Utange Health Center in Kisauni constituency are the only operational cholera treatment centers, with the county government maintaining everything is under control. Even with a contained cholera outbreak here in Mombasa County, such dump sites continue to pose as a health risk and avail a chance of a recurrence of this contagious disease. Reporting from Majengo here in Mombasa County, I'm Juni Karisa.